start recording this session so you guys have an access to this later on. Before we start today's session, I just want to know that anybody has any issue, any concerns with the yesterday's session. If you have any questions related to that, those who have any problem, did you send me your letter?
No, ma'am, I didn't write, but today I will
Yes.
send, ma'am.
Okay, so you must try. Very important.
Yes, I'll write, ma'am.
Okay. Anybody else has any issues? Yes.
Hello, Jasleen.
Yes, Niba.
When I have written the letter regarding the social history, I could able to write only the one line, like he lives with his parents along with two siblings. That's it. So I think in one paragraph we should at least write 2 to 3 lines. So the paragraph is not becoming. So what should I do?
Fine. Anybody else has any concerns?
Yes, ma'am. This side Renu Gulati, ma'am. Good morning, ma'am.
Good morning, Renu. Yes, I was waiting for you. Okay, so like you asked Nibha, yeah, that's fine. If you want, it is not that second paragraph is fixed for the social history only. You can write in that about the plan which they have written, that it is not fixed, that first should be this, first of course is fixed. Yeah, always will be a primary issue. Second and third is not fixed. If you want, even if you will write like this, this gives an impression to the examiner that there's a fixed template in your mind. So that's not a good thing. So if you want, you can add on the plan as well, that now he's recovering well, he requires this, and apart from his social history is this, as he lives with his family. So social history you can write at the end 2 lines in the second para. If you just want to write some more information, you can add on. Okay. But yes, I understood your point that you have only 1 or 2 lines to write. So, but yes, you can add on that. Okay, anybody else has any concerns?
Yes, ma'am.
Yes, dear, tell me. So, which problem you were facing, Renu? Tell me that.
Yes, ma'am. Ma'am, I'm not able to get in points that's about relevant or irrelevant now to how to choose that words or phrases. And ma'am, linking words also, I got problem in linking words.
You don't focus
Where
on
to
linking
use.
word as of now. Don't use as of now. But only you keep in mind that you replace but with the however. That's it. Main focus is now to learn the basic things for connecting words we'll use. So I'm going to share the screen with this. So you need to tell me that what are the problems that you are facing in selecting the notes. Tell me which particular thing is bothering you, what is relevant, irrelevant. I hope you can see the screen.
Yes, ma'am.
Yeah, so tell me what is bothering you here. Which particular line or sentence or phrase you think that it is not relevant or you're confused?
Actually, I have confusion in that where we will write these lines or where we not.
Where you will write these lines.
Yes,
Okay,
ma'am.
so
And in which paragraph? So many.
no, that's what I was just answering to you just now. It is not important that, that where you have to decide to whom you are writing and what is important for that person. Okay. Now that's very thing. Now in this letter, you know that this letter is for the rehabilitation center. If you you know the job of rehab center. So what they do? So what they do actually?
They do only exercise programs and occupational therapists. They
Hmm.
don't need any details about medications and all.
Right. So basically they do the long-term care, right?
Yes, ma'am.
Yeah. So if you know that, then based on that, you will select your notes. For example, it is written here when it from the starting itself. As I told you in introduction, what are the three things that you need to mention?
Ma'am, to why you are writing first,
Mm-hmm. Mm-hmm.
and then ma'am, current condition,
Mm-hmm.
and ma'am, discharge plan. I'm not sure,
Mm-hmm.
but discharge plan was there.
Right. Not discharge plan. It is only
Okay,
just a line about discharge that he is being discharged today, tomorrow, or day
okay, ma'am.
after, like that. Yeah, not the plan. Okay.
Okay, ma'am.
So three things fill in intro. Why you're writing a letter, that means the purpose, and purpose should be clearly defined. What is the current condition of the patient that you will write? Like most of you have written, he has multiple injuries. That is over. Yeah, he got operated. So write he underwent surgery. That's the current thing, and that's why from that after the surgery he required the rehab care. Clear? So
Yes,
that is the
ma'am.
current condition. So these three things will be in your intro. And what will be in the first paragraph?
Ma'am, in first paragraph, in introduction.
No, introduction is over. After the introduction, what you will write in the first para?
Okay, ma'am.
No, I'm asking what you will write in that. I've already taken a session on that. So what you will write in the first para?
Ma'am, present complaints.
Okay, all right. Lissy, are you there?
Yes, ma'am.
Lissy, what you're going to write in the first para?
Ma'am, related to introduction, what all things done during this hospitalization?
Mhm. What is content? What do you mean by content? Sukhveer, can you explain that?
Ma'am, I just want to say that Renu is new na, so that's why
Mm-hmm.
she is having some issue. If means if she will get some detail means discussion on Hindi, then I think she will understand.
Okay. Thank you
Yeah,
so
thank
much,
you.
madam.
Thank you
My
No,
so much.
ma'am,
question to you
ma'am,
is, what is content? My question was not to you about Renu. My question was, I know what is her issue and I know how to resolve that, how to explain.
sorry, ma'am,
My
ma'am,
question to
sorry,
you is, it's okay. That's not my question to you
ma'am,
is,
ma'am,
what is
really very
content?
sorry,
It's okay, not an issue. I'm just kidding. Just tell me what is content.
ma'am, don't know, ma'am,
Content.
ma'am,
Okay. What
content
to
means
what
and
to write in first paragraph? Okay, tell me that.
ma'am, the present condition means from which the person or the patient is suffering from recently, means if the diagnosis is diabetes and he is suffering from any other issue, then I have to write for that issue only, not for the diabetes.
Okay. All right. So let me give a clarity. Now, this is very important, okay, for everyone to understand and listen it. The most important, the first assessment criteria of writing, as I told yesterday, is the purpose. You have to explain your purpose very well in the introduction. That is the first criteria. If in introduction the purpose is clearly defined, That means you will get 3 marks out of that. Okay. Now there are total 5-6 steps like that. And the second assessment criteria of writing is the content. Okay, which has 7 marks. 7. And I tell you, this intro and the first paragraph is very important. If you have written your intro and first paragraph clear, you will get B grade. Even though your second and third is not well organized, still you will get B, because that means you got the clarity of the text. You understood what they are asking and what you have to tell. Okay, so please focus on that. So when I say the purpose is the first assessment criteria, means purpose is why you are writing. It should be clearly written in the introduction. And when I say content means explanation of your purpose. That's what I wanted to hear. Explanation of purpose. That is a second assessment criteria, and it has 7 marks. And it means that whatever is your purpose, for example, here you have written, you're transferring the patient for further assistance and further rehab care, in short. Right? That is your purpose. You have mentioned in intro, fine. Explanation of that reason that why this patient needs rehab care will come in the first paragraph. रेणु, बहुत क्लियर है बेटा कि अगर इंट्रोडक्शन में आपने लिखा है कि इस पेशेंट को ये केयर चाहिए, उस केयर को आपको फर्स्ट पैराग्राफ में एक्सप्लेन करना है. देयर इज नो फिक्स टेम्पलेट कि आपको फर्स्ट पैराग्राफ में एडमिशन डिटेल ही लिखना है, सेकंड में सोशल ही लिखना है, थर्ड में यही लिखना है. ऐसा कुछ फिक्स नहीं है. इफ यू विल फिक्स इट, no, they will understood that you have something fixed in the mind and they will deduct the marks. So there is nothing fixed. It depends कि आप किसको लिख रहे हो letter, to whom you are writing, okay, and why you are writing. Why you are writing should be very clearly written in the introduction. You will clearly get 3 marks. And coming to the first para, which I'm very clearly saying this, as per the assessment criteria, first paragraph में explanation of the introduction should be there, not introduction of the purpose. अगर मेरा purpose है, let's say my purpose is I'm writing to the dietitian and I'm saying that this patient need your advice on for diabetic management, dietary advice on diabetic management. So what is important in the first para? I will not write about the diabetics. Now that's a mistake. I will not write about the diabetics that this patient has diabetes for so many years on this medication. No. In the first para, I will give all the advice about the diet means what kind of a patient diet now takes. And because of that, everything is that his sugar level is not managed. And that's the reason he or she requires your advice.
Okay.
You got my point?
Yes, ma'am. Yes, ma'am.
Okay. So keep that fix in mind that first paragraph, you will always explain your purpose. Always. Okay.
Yes,
so you will explain your purpose in that. I hope it's clear to everyone.
Yes.
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 So remember, this content is very important. Now everybody listen, it's clear? Sukhbir, clear, dear?
Yes, ma'am.
Okay. All right.
Yes,
so next time you should know what is content. Content means you will explain your purpose.
Explanation.
Whatever is the purpose.
Yes, ma'am.
Okay, great. So this is what will be in the first paragraph. So when you read a task like this, Renu, so keep in mind that if my purpose is this, that this patient require assisted rehab care, so that means what I'm going to write in a first paragraph, that why this patient needs this care.
Yes, ma'am.
And why means then I'm going to write about the post of care, not about the admission details.
Okay, ma'am.
My focus should be more on the post-op care, that after this, I will just give a background, that this patient had an accident and then he underwent surgery, and then post-operatively, this is the condition. So my first paragraph will be more focused on the post-op care, because that is what is explanation of my purpose. If I will write he had a bore surgery, he was managed with IV fluids, he was managed with this, that why he requires further, it's fine. But for a rehab person who's uh, if I am a rehab nurse, I need to know that why this patient need a long care. Yes. So
Yes,
that's
ma'am.
what, then post-op care, everything I will write in the first paragraph. And I will, if I'm writing this letter to a doctor, I'm again saying, let's say I'm writing this letter to a neurologist, to another center, transferring under neurologist. So then I have to write everything which is given here on the first page, this one, that treatment part, especially that everything I will write, each line, that he had a burr hole opening for rapid decompression, craniotomy to alleviate depressed bone and control bleeding, intercostal nerve block with local anesthesia, adequate ventilation, humidified oxygen, crystalloid skeletal cast, IV, and high fluid intake. Then I will write this each and every point if I'm writing to a neurologist or to any doctor. Are you getting me?
Yes, ma'am.
Okay, but now I'm writing to a rehab whose focus is only on his mobility, his ADLs, his dressing. That's it. These are the three things only in the discharge plan, right? If you go to the discharge plan, you will see here it is written transfer for post-acute rehab management. Very clear purpose is given. You can write the same line even in your intro. Require assistance with washing and dressing. Now, very clearly given. So basically, this physiotherapist work, the physio will do. Rest everything they will do. My main job for the rehab purpose is only this: require assistance with washing and dressing.
Dressing.
Only two things. So instead of washing, I can write ADLs and I can write the dressing word.
Okay.
Okay.
Yes,
So
ma'am.
I know my purpose is that this patient need washing and dressing. So what I'm going to write in first paragraph, that why this patient need this assistance. So if I will explain more about the surgery and the treatment which is done there, does that make any sense or relation to the ADLs?
Mm,
वो एडीएल के साथ कोई लिंक नहीं ना बना रहा। अगर मैं ये लिखूंगी कि इसकी bleeding control हुआ, humidified oxygen and skeleton cast was applied and all the traction IV morphine was given, do you think that make any link with the ADLs? नहीं बन रहा ना?
no,
तो
ma'am.
ये नहीं बन रहा, तो ये एक्सप्लेनेशन नहीं है। तो एक्सप्लेनेशन क्या होगी? एक्सप्लेनेशन आएगी ये नर्सिंग केयर, that post-op drainage for several day or reaccumulation of blood and all, then patient was this frightened, unable to bear weight, largely immobile. Now this is very important. Is unable to bear unable to bear weight, largely immobile means he cannot walk, require assistance with toileting and shower. A very clear indication. If I will write this line in my first para, that this is his current situation. As an examiner, I tell you again and again, everyone, please note, as an examiner, if I have 100 letters to correct, I will read only the intro and first para, and I will decide that if I want to give B or C plus to this person. Based on your intro and first para, examiner will only decide that you need B or C plus or C. Okay, so if in a first para you will write all about the surgery details, it's not going to solve my purpose. Is that clear?
Yes, ma'am.
Okay, now let's have a focus on this today only. So a second and third para. Now most of you had confusion with this. Now second and third para, when I say, um, that means As I said now, the content means you're going to explain that in the first para. Now, transfer, I told you yesterday there are three types of letter: transfer, referral, and discharge. Transfer or referral means you are sending this, transferring or referring this patient to someone new. Someone new, first time. So that means you need to tell everything about the patient. Everything means patient social history, patient past medical history, patient's current problems, of course. Then you're going to mention all these things. And I feel that when you're sending it to a rehab center, you just have to give information that this patient is in second para, that going for this, has a family, lives with that. Now, if you want, you can even write the discharge plan in the second para, and at the third para, you can write the, that he lives with his wife, with his family and all that. Yes, that's it. It is not fixed. It's only your letter should make some sense. Are you getting me? So it should be like a story. When I read this task, now look at this. This task, how they start this task. They started with patient name, age, admitted, diagnosis. Then they have written reason for admission, the patient admitted. Then they have written the treatment. After the treatment, they have written the nursing notes. And then medical history is also given. And then the discharge plan. Yeah. So they have written it like this. It is like a sequence. If you will see, it is a sequence. So same way in your letter, it should be a sequence when you write the patient admitted with this problem, he underwent surgery, post-operatively, this is the condition. Now in a second para, if you want, you think that there's nothing more to write apart from this social history. Of course, you can look at the past medical history of the patient. So you can add on the current medication, that he is on this medication now. Okay. And then you can write the third para, the discharge plan. If you want, if you feel that there is nothing much to write in a second para, you can also change that to the third. Because anyway, that's not important. First paragraph would be, keep that simple thing in mind. First paragraph will always be the primary reason of your purpose. Primary means main reason. And second paragraph would be secondary reason. Why do you think social history is a secondary reason here? Why I said that you write the social history in a secondary? Can anybody tell me that how this social history is relevant to this rehab center? Why I think that this should be in a second para as a secondary reason? Jose, what you think? Anybody?
Because because
Yeah, tell
ma'am,
me. Yeah.
because a social worker is also included in this rehab center, no? So that is relevant for this socio-economic background. Is that the reason why that is included, ma'am?
Yeah, thank you so much. Thank you so much. That's what I say, always read the discharge plan. That is a secondary reason. You're referring to the social worker, and even though, because you are going to discharge the patient. I'm from a hospital nurse. I sent this patient, transferred this patient to the rehab nurse. And to whom rehab nurse will refer? She will send back to you. She will discharge the patient from there, right? Then she should know that where she will send this patient after discharge, either to the nursing home. In UK, Jost, you might be aware, the old age nursing homes and the other nursing homes are very common, where the patient stays for a
Yes,
long
yes.
time. Yeah. So,
Yes, yes.
so that means, as a nurse, even though I'm a rehab nurse, I should know that after the discharge, where I have to send the patient to the any nursing home where he lives. It's very important for me to know if there is anyone whom I can connect. So that all information is important. So that will come as a secondary reason. Okay, so there is nothing fixed from the task. If you understood what is secondary reason, then it is really good. You got my point, Renu?
Yes, ma'am.
So third para is going to be the other reason, probably the discharge instructions which you can give. Any request which you have, the final request. Okay, so now once this thing is clear to you, then nothing is difficult to find out from the task that what is relevant or irrelevant. Okay, is this thing clear? Now this is the part of your transfer or referral letter. Same format, so not that difficult. So that's what I said. If you get confused, this is a transfer letter or referral letter, doesn't matter because the way of writing is same. The only word which will make difference to the examiner to understand, okay, तो आपको समझ नहीं आया कि ये transfer था या referral था, because you have written in the intro that I'm writing to refer, I'm writing to transfer. Avoid that word, write a other word, I'm writing to request, urgent, I'm writing to request rehab care for Mr. X. Write in that way. Don't use refer or transfer word if you're confused. Are you getting me?
Yes, ma'am.
Okay. Now another type is which is the most important thing is a discharge letter, because next letter which I will discuss next week would be a discharge letter. Okay. So that's very important. So I will discuss, but before that you should know the discharge letter. What is the difference in discharge letter? Lissy? Difference in discharge and transfer or referral letter. Lissy, are you there?
Yes, ma'am. Yes, yes.
Yeah, tell me please.
In transfer letter, patient is transferred from one facility to another facility, and
No, that is clear. As we have already discussed about the transfer or referral letter, I just want to know the format of for the discharge letter. That what is the difference, which we should not write in a discharge format.
in discharge letter, if we are discharging the patient in discharge from the hospital in same facility, then we do not uh, write any past medical history
Mm.
uh, and social history and all.
Mm. Okay, all right.
Mm.
Yes, Savita, you want to add something?
No, when we are discharging, that means I think it's a known case to the other to whom we are referring. If they
Thank you
know
so much, Savita. That's what I wanted to hear. So basically, please make a notes for these things. If you like some of your new, so please make your notes. The main difference in the discharge, when I say the transfer and referral is almost same kind of a letter. But when it comes to the discharge letter, there's a lot of difference. Discharge means patient will be always discharged to the known person. Okay? To the known person. Then it would be a discharge letter. Known person. Known means, let's say in this letter, if I'm a rehab nurse, I'm discharging the patient. So I'm referring the patient to the probably to the family. Yeah, he's fine now. He's stable. He doesn't require. However, if I want, I can refer to the community. That would be a referral. But in that case, if there is now there are many cases. Let's say there is a home care nurse who is taking care of this patient before he admitted. So that would also be a discharge letter. If I'm writing the letter to the GP, Patient GP. Let's say the patient is getting discharged and I'm writing to the GP. When it is written GP means general practitioner, and general practitioner there means a family doctor who knows everything about the patient. Okay, you don't need to tell the GP. If it is written, write a letter to the patient's GP. Patient's GP. So very clearly that post of comma as says that this doctor, this GP, GP means always patient's own doctor. So you will not tell that person in the letter about the patient's past medical history, patient's social history. That all would be irrelevant. Why? Because that person already knows. Let's say the patient is staying in an old age home for last 10 years and he was admitted in a hospital for a knee replacement. And after the knee replacement, I'm writing a discharge letter to the nursing home, to the same nursing home where he's staying for 10 years. So do I need to give all the past medical and social history? Yes,
No,
Renu?
no.
No. I will not share that details in that case because this patient is already staying there for so many years. I don't need to tell. Yes? Jost, you got some clarity? Guys, are you there? Hello?
Yes, ma'am.
Okay, so you got some clarity?
Yes, ma'am. Yes.
Yes, Siri Lakshmi. Hi, good morning. You can unmute yourself.
Yes, ma'am, I can hear you, ma'am.
Okay, so Lakshmi, you got the point what I'm trying to say?
Yes, ma'am, yes, ma'am.
Yeah, so any questions related to that which you have in mind? You already heard this letter yesterday. So if you have
Yes,
any questions in mind for this.
ma'am, I have a doubt that you said that the introduction paragraph we can start. I'm writing to transfer, or I'm writing to refer. So instead of that, can we use like thank you for accepting Mr. X or thank you for seeing Mr. X? So can we start like this?
Well, if I honestly say that is a format for the doctors, but there is nothing fixed that only doctors can write like that. Of course, we can also write like that. But again, if you, I don't know how many of you are listening to the OET on a daily basis because every week they have a session. So,
Yes.
in which Rebecca very clearly says that it's good to start with I'm writing to refer because that gives a clear cut information to the examiner that what you understood from the letter. Okay, so the examiner get the clarity that did you understand the task well? Did you understand the type of letter? So that gives the clarity to the examiner. So anyway, but yes, you can start with this. Thank you so much for accepting this patient, Mr. X, who requires this. Of course, you can write like that as well. That would not be wrong.
Okay, ma'am.
Okay, that's also fine. Yeah, anything else?
Nothing, ma'am.
Okay, so coming back to you, Renu. So if I hope this format is clear to you that what to write in first, second, and third.
Yes, ma'am.
Yeah,
Yes,
second
ma'am.
para would be secondary reason. Just keep that in mind. So what
Yes,
is the
ma'am.
second reason here? Second reason here because I'm writing to the social worker as well. I'm in referring this patient, so I need to give a social background as well.
Yes,
But
ma'am.
yes, as under the past medical history, there is nothing else here because it is written NAD, only the current medication. So I can add that in the second para.
Okay, ma'am.
That currently he is on this medications. That's it.
Okay, ma'am.
Okay. So now you can, if it is, I told you that two things in mind. First, that you need to keep in mind to whom you're writing. Because of that, the selective case notes will change. Okay. So first para, when I say that this patient needs care, that means your brain should ask why this patient needs care. That need to be answered in a first para,
Okay, ma'am.
right? So main reason here is that he is not able to walk now. He is not able to bear weight now. He requires assistance in toileting and shower. That's written in the nursing notes. Then if I look at the treatment part, it doesn't seem to be that important to a rehab center, right? And same way that victim admitted. So I just need to give a background. This patient was admitted on this date with head injury and multiple fractures. And he subsequently he underwent surgery for rapid decompression. Whatever, if you have written there, no need to repeat. And post-operatively, this is the condition. So you write that. Okay.
Okay, ma'am.
No, if still you need some clarity, please let me know. I don't mind. Okay. Any particular line or any particular sentence which you think that why it is relevant or irrelevant? Anything from this letter? You tried yesterday, right?
Yes, ma'am.
Yeah. So tell me any sentence which you think is not relevant or you're confused with that.
No, ma'am, I think it's clear, but
Just
I'll
try
try
it today.
more and more. Yes.
Yeah. So just try, write this letter,
Okay.
and then we can do that.
Okay, ma'am.
Okay. So Nibha, I guess you also got the answer of your question.
Yes, Jasleen, I got it. Thank you.
Okay. All right. Great. So if everything is clear to you guys, that's perfectly fine. So Jose, I expect that you will write the letter today. Yes?
Yes, ma'am. I'll write it because I was looking for a job here, so I was busy in
So you're busy in that.
attend. So I was attending interviews, submitting resumes, all those things were there.
Okay, so you're busy in that. Okay, no issues. I understand that. Okay. All right. So anybody has any confusion, still let me know so that we can move forward with other things then.
Yes, ma'am.
No issues? Okay, it seems it's clear to everyone. Yeah?
Yes, ma'am.
Yes, ma'am.
Okay, all right. So I will just share now since you guys are a bit confused with that. So let me just share one format of this. I believe, I don't know if you guys, I have already shared this writing notes with some of the people, those who have shared their email ID with that links. So it says, as I told you yesterday, so basically there is a 45 minutes, 5 minutes for reading and 40 minutes writing. 180 to 200 words plus minus 10 words is okay. I mean, if you write 160, 170 and 210 is fine. They can accept that. But yes, each paragraph should contain at least 2 sentences. And very importantly in introduction, because sometimes I still notice that you guys write only one line introduction. One sentence introduction. No, Introduction should always be at least of 2 sentences. Break down the intro in between. Don't connect it with as this. Put a full stop, write a different line. Okay. Another important thing, please make out notes if now from this, that if you have any confusion. The diseases, when you write any disease, okay, it's written in full and small letters if composed of 1 or 2 words. Example, diabetes mellitus and gout. Okay, so when any disease like diabetes mellitus, when you write, don't write DM. Okay, so write diabetes mellitus and gout. Write a full in small letters. You will not write the capital letters. Is that clear?
Yes, ma'am.
Okay. Second point is where you write in abbreviations, that will always come in a capital letters. For example, UTI and URTI. Now, this is universally acceptable abbreviations. You can write UTI, you can write HT, probably hypertension, some people, but it is not a universal. Some people use it, some people don't. You know, some have abbreviations which are local based, so probably they'll not. But UTI and URTI is an international abbreviations which you can use it. But when you use it, make sure it should be in a capital letters. Clear?
Yes,
Okay. Coming to the same way in investigation, that will always, if you're writing a abbreviation like CBC, you're not writing, if you're writing a complete blood count, there is some background noise, guys. Can mute. Okay, thank you. Okay, so investigations, if you're writing a CBC, then it will be again a capital letter. But if you're writing complete blood count, then complete C will be small. It will not be capital. Clear?
okay.
Okay. I hope you guys are making notes. Yeah,
Yes,
if you want, you can take a screenshot as well from your Skype even. There is a sign of on that mobile. You can just click on that. You'll get the screenshot. Okay. So drugs, when you're writing, again, now very confusing here. You should know the trade name and generic name. So if it is a generic like paracetamol, you can write no need of capital words, small letters. But if you're writing a trade name like Ventolin, the V would be capital. Okay, clear?
Yes,
Okay, so that's what his points is given. Don't forget to use capital letter for full stop and small letters after commas. Very, very important. Where to put a full stop and where this commas. For example, some of you write, however, this was different. Now, however, he doesn't like this. However, he is a subject. If there is any word which you use connecting words like that from the subject, you will always put a comma. I hope it's clear to everyone.
yes, sir.
Yeah, so the one thing keep in mind, I always say, don't write, and even in speaking, don't speak long sentences. When we speak or write long sentences, we do a lot of mistakes. Avoid, and the best thing, that write simple sentences. Okay, another thing, never mixing the tenses in same paragraph except body one. So that means that I told you that when you write a letter, especially the first paragraph, it will, because it's mostly about the issues which social history. Now that's very important from a grammar point of view to understand. When you write patient was admitted, no, patient was admitted. Was means was admitted. Which tense it is? Can anybody tell me? Mr. X was admitted in hospital. Which tense it is?
Past.
Past.
Is it only past or something else? Okay. If I say Mr. X admitted in hospital yesterday, which tense it is? I'm not using was. I'm saying Mr. X admitted in hospital yesterday.
Simple past, ma'am.
And then what is Mr. X was admitted? Which tense it is?
Past perfect.
Past perfect.
Past passive.
Past passive.
Yeah, it is past passive.
Passive voice.
Yes, passive voice. Very important. Now, this keep in mind and write in your notebooks now. When you write a passive sentence, Mr. X was admitted. That is fine. But if you're writing Miss X was presented to our clinic yesterday, is it right or wrong?
It's wrong.
Wrong. Why? Why it is wrong? Mhm.
By he's not
Okay.
admitted. He's
Yeah.
somebody.
Okay, let me just give you a clarity on the passive tense, though it is not a grammar session today, but still I would like to give you clarity. Passive tense, we always, it is used by the third person. Now, third person means, for example, I'm talking to you guys. Is it active or passive? If I'm talking to Lissy now, is it active or passive?
Active.
Active.
Active. So when, let's say Savita did not attend today's session, okay, whatever I talk to Lissy. Now Lissy is saying the same, conveying the same thing to the Savita.
That is
Which tense is that?
passive. Passive.
Passive. Okay. So you got the clarity now?
Yes. Yes.
Okay. If the two person are talking to each other, active conversation. When that second person, anyone out of these two people, is telling the same information to the third person, that is a passive.
Okay.
Got it? So when I'm saying admitted means it's done by somebody else. When I say presented, means self-presented. Presented cannot be with the third person. Third person can bring. He was brought to emergency. That means he was brought to emergency by someone else. He presented to emergency means he walked in. He walked in himself. Himself means active. That cannot be passive.
Okay. Okay.
Okay, so you will never use, keep in mind and write it notes, you will never use was presented. That is absolutely wrong. Presented is self-presented. So was presented clinic is absolutely wrong sentence. Got the clarity?
Yes.
Okay, great. All right. So now this is the one mistake. Now somebody says his wound was healed well. His wound was healed well. So let me just text it in to make it more interesting. I hope you guys can see the screen. I'm just texting it. So let me know his wound was healed well. So is this is this right or wrong that you need to tell me? Yes, okay. Yes, everyone quickly. You can tell, you can speak out.
It's wrong.
It's wrong. Why?
It's wrong, ma'am.
When we
Why?
say
So what will be the right sentence?
wound healed well,
Is wound healed well. So what is the difference in both?
Wound was healed means
with
with the help of someone, his wound has healed.
Hmm.
and it's a natural process, so was won't be there.
Yeah, thank you so much, Lissy. Wound healing is a natural process. It cannot be by someone else.
Yes.
Okay, so these two are very common mistakes in OET letters. People write was presented, they write his wound was healed well. Absolutely wrong. His wound healed well. And if I'm right talking about the present, that now his wound has healed well. Present perfect. But if I have to talk about past, his wound healed well. I think these two things are clear. Yes.
Yes, ma'am.
Ma'am, then we are sometimes we need to write a letter about a baby. Then suppose baby John Mark presented with his mother. Can we write that? In that case, we can use was.
If you want, you can write that baby John was admitted to hospital or was brought to hospital or was accompanied by her mother. You can write in that way. You can't write that Miss John was presented with mother, that's wrong. Was admitted, was brought, that you can write. Was accompanied. Clear?
Clear, ma'am.
Okay. All right. So keep these few things in mind. And I always say, very important, that avoid mixing tenses. Now, when you write a first paragraph is, as I told you, is always about you need to give the reason that why it is so. For example, in the same letter, you're telling about he underwent surgery and then post-op cure. Now, all the things is in the past or present or future. What is that? Yeah. Yes, Lakshmi? Lakshmi, are you there?
Yes, ma'am.
So tell me, is that what we are writing in a first paragraph of the same letter which we discussed is the past, present, or future?
Ma'am, I didn't get you, ma'am.
My question is, dear, that the letter which we have discussed today and even yesterday, in that I told that in a first para, you will write more about that he underwent surgery and then you will write the post-op care. Now that event is in the past, present. You will write that all the details in the past tense or the present tense.
I will write in the simple past tense.
Simple past tense. Very good. Thank you. So remember, that's what I want to tell you. You know, there are easy way to write the letters. If you will fix this in your mind, you will only use the simple past tense or maximum he had these symptoms, the past perfect you can use, but avoid using the past perfect. You write your that all the previous details in the simple past and use the passive tense. At least 2 passive sentences in the first para. Very important. I'm saying 2 passive sentences. So every time it should not be like John admitted this, and then you're writing he, this, he. Every time the subject should not be he. You can make it to the past tense. What is the past passive tense? You can write, for example, he was commenced on antibiotics. You can write antibiotics were commenced, or were initiated, or were started. Are you getting me? So this past passive, you have to write at least 2 sentences in the, like first sentence is already past passive, that he was admitted. Now another past passive in between is very important. So I'm telling you this grammar point of view, these things you need to keep in mind for the first para. Is that clear to everyone?
Yes, ma'am.
Yes, ma'am.
So which tense you're going to use in the first paragraph?
Simple past tense.
Simple past.
Simple past tense?
And passive voice.
Passive.
Past passive.
At
Very
least
good.
2 sentences. Passive.
Yes. Okay. All right. Second para. Now let's take in the same example. Second para, social history. So social history will be in which tense?
Simple present.
Present tense.
Tense, ma'am.
Yeah. Guys, I hope my voice is clear to you all.
Yes, ma'am. Simple present.
Okay. Simple present. Yes. So that's social history will always be in simple present tense. You will not change the tense for the social history. For example, we write, she lives alone, she lives with the family, she's a smoker, she smokes, she's a chronic smoker, she smokes and drinks. Always simple present tense. Is that clear? Okay. Please note down, social history, always in simple present tense. Coming to the past medical history. Unfortunately, in this letter which we discussed, there was no past medical history. But otherwise, which kind of a sentences, not sentence tense, you use for past medical history? That is also fixed. So please note down. Yes, past medical history, which tense? Savita.
Present perfect tense can be used.
Sorry?
Present perfect tense we can use, Nama.
Past perfect tense. Very good. Can you give me an example?
Like has had diabetes mellitus, has had
Yeah,
hypertension.
he has had diabetic mellitus since 2010. Very good. Okay. All right. Any other tense? Yeah, anyone else? Nibha?
Ma'am,
Yes, Jose.
can we use the sentence like he was having
Sorry?
past continuous, like he was having?
No, we avoid that.
No.
Continuous we avoid in speaking as well as in writing. It doesn't give a good impression.
Oh, right.
Okay,
Had,
so only past perfect, or is there any tense? Sukhbir?
had been
Ma'am
Yeah.
has been diagnosed. Like,
What tense it is?
ma'am,
past perfect.
ma'am, present perfect passive.
Hmm?
Okay.
Is
No, no, no,
it?
no, no, no.
Forget the tenses, huh? Okay, anyhow. So past
Ma'am,
medical
past
history.
perfect. Ma'am, past perfect.
No, that is already done. Past perfect. What else? So which tense it is, like you guys are saying? Let's say she said he has had diabetes. Let's say I'm saying he has been smoking or he has been drinking for the past 30 years.
Past perfect continuous tense is it?
Thank you so much. So we will use this is the example of, in fact, a social history, but it's coming to the past medical history. He has been diagnosed with asthma since childhood. Any problem in the past and still continued. The perfect tense to use is
Has been.
has been. What's the name of that? The present perfect continuous tense. This is called past perfect continuous tense. He had been. Anything? Let's say he had some problem in the past and it is over now. It's not there. Then I can use the past perfect continuous. But if it is something in the past and still continue, remember, whenever in the task it is written something like that, for example, you're writing about a child, he's 13 years old now, and but it is written that he has asthma since his childhood. So the best tense to use here, he has been diagnosed with asthma since childhood. Is that clear? Yeah. So please note down that to write about the past medical history. And now how to connect. Let's say it is written. It's an example. Okay. I want you all to write that. Please write down this. You're going to text me here that how you're gonna write it in the chat box. So the question is that Mr. X is diabetic, is diabetic. Okay, I'm writing Mr. X is diabetic and hypertensive for 10 years. Medications are metformin and amlodipine. Can you write this into, can you make a sentence for this? Yes, you guys can speak up as well. Okay, Lakshmi, you can tell me.
Ma'am, hypertension since 10 years, for which medication of metformin and amlodipine. I
Okay. Now, this is very important to learn out of this sentence. When anything like this is written in the task, I think the best thing is like the Sukhbir has written. You always write Mr. X has had diabetes, mellitus, and hypertension, for which he takes metformin and amlodipine. Now, why we have to write this in a simple present tense? Because he still takes that. Takes. So something, remember that simple present tense we use when we write something on a daily basis. Let's say if somebody is asking about your routine, that what is your routine, Renu? Then Renu will answer in the simple present tense. I get up early, I go to this, I do that, I do. So every tense will be in the simple present tense. So he has had this problem since past, for which, now this is a complex tense. Please keep this in your mind. Whenever you get a sentence, you have to make a sentence like this. For which he takes metformin and amlodipine. Very nicely constructed. Is that clear to everyone?
Yes.
yes, ma'am.
Yes? So I will take the next week the session on how to construct the case notes. We'll work on that, so don't worry. This is how we will learn, okay? But you need to keep in this mind. The social history will always in simple present, past medical. I told you this sentence, what left it? Discharge plan. Discharge plan is something you are going to advise about the future. So which tense you are going to write? That you have to do this, he required this, he do this. So discharge paragraph is the only para where you can mix up all the tenses. Okay, all the tenses mix up means, I'm not saying because to add anything past tense, no, because this is about the present and future. So you should write everything in this. What are, please write down the tenses which you're going to use in the third para, especially in the discharge plan. You can use simple present tense. For example, you will write, upon discharge, he requires daily dressing. Which tense it is? He requires.
Simple present tense.
Simple present tense. So you are going to use simple present tense, first number. Second number, you're going to use the present perfect continuous passive. Passive. Present perfect continuous passive. So what kind of a tense is that? For example, you will say, Sukhbir, can you give me an example for that?
Ma'am has been suffering like that.
I'm talking about discharge plan.
Ma'am, what I have to say, ma'am? Ma'am, I didn't get your question.
I want to hear an example from you in the discharge para where we use the present perfect continuous tense, passive.
Okay, ma'am, if there is any advice, then we can write like it has been suggested to continue with her medication.
Okay. It has been, or you can write he has been. He has been advised to continue the medication for another week. Let's say he's already taking Panadol 40 and in the discharge plan it is written continue pain medication for 1 week. So then this how you will make a sentence. You can write he has been advised to continue tap Panadol 40 for another week. Instead of writing for 1 more week, for another week. Is that clear? Okay, so third tense which you can use is a future tense, future passive tense. Again, simple future passive. Can you give me an example for that, anyone?
let's say his sutures will, even I am giving you an example, okay.
A suture is advised to cut on or remove on after 15 days. How you will write this tense in a future passive? Yes? Sutures to be removed after 15 days. It is written in the task. So how you will make this sentence? You will change this sentence into the future passive. It is written to be removed. I'm saying you to because you need to change the tense. You cannot copy paste the same, right? You need to write in a different way. So how you will make this into the future passive? Come on, quickly, everyone.
His suture will get removed 15 days later.
You're saying his sutures will get
Removed.
his sutures will get removed. Okay. This is by Nibha. Okay. Anyone else? Sorry? I think I can't. Can you please type? Because everybody's saying, Lakshmi, I need it from your side as well. Savita, Lisi,
Suture has to be removed.
his sutures has to be removed. Which tense it is?
Has to be removed.
Has to be.
Future.
Has is a perfect tense, dear.
Okay.
So it is a present perfect.
This,
Then it again comes to be. No, in the task also written to be, and you are also again using to be. We need to change the tense.
Would be.
Yes, Kulvinder? Okay, Lakshmi has written his sutures will be removed after 15 days. Okay. Kulvinder also will be. Sutures would be removed. Okay.
I don't know.
Okay. All right. So this is good one. His sutures will get removed. Get is not a right word, Nibha. Okay. So the best way to write it in the passive is his sutures will be removed after 15 days. We have to avoid to be. So it will be.
Okay.
Okay. Would, if you will go, we use actually for the past things. It's a past passive. Okay, so is that clear to everyone now? You got some clarity how to use and make the sentences?
Yes, ma'am.
So in the discharge plan, in the third para, I don't want you to repeat the same tense. You can use a variety of tenses. You can use simple present, present perfect, present perfect continuous. You can also use the future.
Removed, discharged,
Yes?
oh, okay.
Yeah, is it clear to everyone?
Yes,
Great. Yeah, so that's please keep in mind that and remember where you have to mix. You cannot mix now in the first para simple past and simple past passive, and then second para social history will be in a simple present past medical history. We can write in the past tense, yeah, past perfect continuous, and others as well. And in a discharge plan, you can use all this. And when you write in a discharge, you know, in that the hospitalization, during the hospitalization, this treatment was done, all that thing which is done in the hospital, either it is admission detail or it is a diagnostic reasons, investigations, treatment, everything will be in the past tense because it's done and recently done. Clear?
Okay.
Okay. So this is what you need to use formal terms. Example, I tell you many times, instead of tell, use inform. I tell you. Even in speaking also, tell is a very casual word. Use the formal terms. So instead of tell, you can use inform. What is the other word that you can say instead of tell?
Tell.
It is written inform. What is the other word instead of tell?
Advice.
Yeah, very good. I would like to tell you, instead of that, I would like to advise you. I would like to recommend you. I would like to suggest you. I would like to inform you. Many words. Yes. And for example, he was started on antibiotics. Don't use the word start. Always use commence. He was commenced on. Commenced. He was commenced on antibiotics. Antibiotics will always be commenced. Medicine will always be commenced, not only antibiotics. But when you write about the other treatments like physio, that started, his physiotherapy was started. Instead of here started, what the word you can use? You can't use here commenced. So what you can use here?
Recommended.
Initiated. Thank you so much. Initiated. Yes, clear?
Yes.
Yes?
Yes, ma'am.
So you got some clarity on the grammar which is used in OET. This is the only tenses. No high-fi vocabulary, no difficult things, only easy grammar which you have to use here. However, some of the things which we will discuss in probably the next week, not this week, because we have to continue with the speaking as well, which we'll do from tomorrow. So you'll understand that as well. So I am sure that now onwards I will not read words like tell, start, done. Somebody wrote yesterday his surgery was done. So what is the better word for done?
Underwent.
He underwent surgery. Fine. Okay. What else? For example, his biopsy was done. CT scan was done. What is the other thing that you can write here for done? Other word.
Undergone. Use undergone.
Underwent, undergone means has. You undergone. Okay, thank you so much for highlighting this as well. Now, someone get confused here. Remember, I told you the things which is done in the hospital, you will always use simple past. Simple past is a underwent. When you use undergone, gone is a third word. That means you have to use has or have, present perfect tense, has undergone or had undergone. But avoid this because you're writing only the simple past tense. Got it? So what is the other word for this done here?
Performed.
X-ray was done. What you will write for this? Sukhveer,
Ma'am, performed.
Performed.
thank you so much. Yes, it was performed. It's a better word. All right? Okay, so now remember that. And another thing, whatever, when you write a discharge plan in the third para, and after that final conclusion, final request, not the conclusion, I'm saying request. Again, you will request that it would be greatly appreciated if you could do this. You're requesting. Now, your introduction and final request should be same. Should be same. It is not that you're writing something else in intro and in final request is about something else. That cannot be. Let's say your intro, your purpose is about this patient need assistance in ADLs, and in final request you're saying it would be really appreciated if you could provide a physiotherapist for the speedy recovery for his mobility. Do you think it is matching? If in introduction you're writing the patient need daily dressing, assistance in daily dressing, and in final request you're saying that he needs physiotherapist, it would be really appreciated if you could provide the services of physiotherapist. Is it matching or not?
No, ma'am.
No, it is not matching. So that is also again wrong. Your introduction and final request should be same. However, please listen to very carefully. However, that means paraphrasing should be there. You cannot copy paste the same introduction and can write in final request. No, you will not copy paste. You will write, meaning should be same of the introduction and the final request, but there should be paraphrase, write different words, use different tenses. Got it? Okay. So that's what you need to keep in mind for this introduction and conclusion paragraphs. And now last point is use article. What is an and a? This is an article. Very important. Use an article with the investigations. He underwent X-ray. Is this right or wrong? Anyone? Let me just write the last one. This is the last one. If you guys are, I know someone is in hurry to go. He underwent X-ray. X-ray, you will always put an hyphen. Remember that. So, is this right or wrong?
Right.
It's wrong. Okay, so what is the correct ones? Please write that. Or you can tell me. Just tell me quickly.
He underwent an X-ray.
Why an X-ray? Why not a X-ray? Why an not a?
An X-ray is correct, no, ma'am.
X-ray is X, and we use an for the vowels, right?
Yes, yes.
And what are the vowels?
Yeah, you, but
It's A, E, I, O, U. Yeah, these are the only words.
then
Yeah.
Then why we are using X with an?
it's vowel sound, not the letters.
It is sound related, and we say X-ray, and if we write, it sounds like this. Yes, and that's the reason we use an X-ray. So you will always use an article. Very important before any investigation. When you're using a name of a profession, you will always use an article. Please keep that in mind. Very important. I will take a separate session on articles. But you should know that with investigations and with the, let's say, he requires physiotherapist. Is this right or wrong? Requires a physiotherapist. Is this right? So remember, you will always use article with the investigation, with the professionals. If I'm saying a diabetologist, a physiotherapist, an anesthetist, an occupational therapist, I will always use that article with the professionals and with the investigations. Is that clear?
Yes.
And after the class, please share your pictures, what the notes you have made. I just want to see the notes which you have made out of this session.
Okay.
Take a picture and send to me now. All right. So anybody has any confusion, any concern, any doubts, any questions, please feel free to ask. And even after the class, if something when you're reading, it's not clear to you, and please, you can also text me immediately. You can send a voice message. I will certainly reply that. Just send a voice message quickly that I have a trouble in this. If I have a time, I will certainly call. If I'm busy, not able to call, I will certainly reply you immediately. Is that clear?
Yes, sir.
So I hope this abbreviation, this where to use capital words and where to use comma and full stop, articles, these things are clear to you?
Yes.
Yes? So generic name, no capital, trade name, first letter capital. Clear? Okay. Yes. Is that clear to everyone? Okay. Any doubts? No? Okay, that's cool. Good. Take care and see you guys tomorrow. And tomorrow we'll definitely have a speaking session. And I'm gonna ask you a questions from that. So be ready with the assessment criteria of speaking because I will ask questions to you and then we'll do it.
Jasleen, when you are planning to take next session on writing?
Next week. I will let you know in the group.
Okay, okay. Thank you.
Okay, all right, guys.
Okay, ma'am.
Okay, see you tomorrow at the same time.
Thank
Okay, bye-bye. Take care. Have a good day.
you.
Bye.
Bye.
Bye,
Bye,
bye.
ma'am.
Bye, bye.
Bye.